Hi everyone, today I wanted to briefly talk about pneumonia. So pneumonia is something that people commonly think of as a lung infection, and pneumon is actually Greek word for lung. So pneumonia can be caused by several things, and usually when a patient has pneumonia, the first thing that healthcare provider will ask or a doctor will ask is what caused the pneumonia. Is it bacterial pneumonia where you would give antibiotics? Is it a viral pneumonia? Is it a fungal pneumonia, meaning you breathed in mold spores? And what happens in pneumonia is, so we have our lungs, and in our lungs there's these air sacs, and we call them alveoli. In pneumonia, they fill with fluid. The reason why they fill with fluid is when you have one of these microbes, these pathogens, like a virus infection, a bacterial infection, or even mold, and they get in and your body tries to fight them. It does inflammation. This is our immune system trying to fight off the microbe. Inflammation is good for fighting off a microbe, but what inflammation also does is it causes a rush of fluid to the area. Think if you have your hand inflamed, like if you hit it, it gets bigger, it gets swollen, gets filled with fluid. That same thing happens in your lungs. And so when that happens in your lungs, it becomes hard to breathe. And so that's the problem with pneumonia, is that it makes it hard to breathe. And you treat every pneumonia differently. So like I said, if a pneumonia is caused by bacteria, you give the person antibiotics. With viral pneumonias, it's just supportive care. You let it go away on its own. And with mold pneumonias, they have their own medications, but mold infections can be hard to treat on their own. So we commonly think of pneumonia as a secondary infection. What that means is the person had a primary infection, and then that led them to be immunocompromised, and then they got the infection after that. So for example, let's say that your primary infection is you have COVID, you have coronavirus, and your body doesn't fight it off well enough. And there's one of two things that could happen. Either the virus will actually get in and cause pneumonia, or the virus makes your immunity so low, you're immunocompromised, that you're more likely to catch on other things like bacteria that cause pneumonia. So that's what pneumonia is at a very, very simple level. And so you can imagine if you're underwater, you can't breathe. So with pneumonia, you try to treat it. A lot of times you give the patient steroids to calm down the inflammation, but pneumonia can be very harsh, especially in immunocompromised people, in little kids, in elderly. So that is a brief version of what pneumonia is.